Hello, it's Mary Lou Novak, the founder of Resource, the number 4 Care, where we help seniors and their adult children navigate caregiving and aging. And we do that through interviewing professionals in the healthcare and wellness arena on educational topics that we think you would find interesting. And we place them up on YouTube and the internet, but you can access it all from the resource4care.com website. Today we have Genell Holloway. Hello, Genell.
Hey, glad to be here.
Thank you. Good to have you. And Genell is an expert in navigating Medicare, amongst other things. But today our topic is navigating Medicare.
Right.
Making those, or knowing what things to ask and what decisions to make. And Genell's company is called Eagle Hollow Enterprises. And Genell, what first is the timing of these decisions? Because I know it's specific, isn't it?
It's very specific, and it's really important that you know what you're doing so that you can make sure that your timing matches what the government says you need to do. So when you get ready to turn 65, typically about 90 to 120 days before you turn 65, you want to reach out and talk with a broker so that you can make a decision as to whether you need to go on Medicare right then. If you're waiting, if you're still working and you have group benefit, you can wait as long as you have credible insurance coverage. If you don't have credible insurance coverage, or if you're not going to continue working so that you lose your work insurance, or maybe they don't offer it to folks after they turn 65, then you need to go on Medicare. Mm-hmm. And there are several different moving parts, and that's why it's confusing to people. I've had people think, well, I wasn't on any prescription medicine,
right?
So I didn't think I needed that. But then they get a penalty later when they do need it, and they add it later. It's kind of the same way with Part A and Part B Medicare. Mm-hmm. You don't need Part B Medicare if you have your group insurance. But if you are going to drop that, or if they're not going to cover you, you can only get that at the time that you turn 65, or you have to wait till the certain time period that the government has set. And that depends on when you reach out and start trying to do that.
Okay. And there's also some restrictions as to when you can enroll during the year, correct?
For Advantage plans, there are some restrictions. Typically, that's when you start seeing all those commercials that lots of people want to go la 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 la.
Right, right.
You get tired of hearing it, but it's October 15th through December 7th. Okay. Now, if you're going on a Medigap plan, which is different than an Advantage plan, you can sign up for that at any point in time, but you go to underwriting if you wait till after your initial enrollment period.
Okay, okay. So I know that there's a difference between being an agent and a broker. Is there an advantage with working with one versus the other, and what are you?
Absolutely. There are some vast differences. An agent is typically captive with one carrier. Okay. And so they can only offer the product that go with that one carrier. Okay. Brokers are typically signed up with multiple carriers, and they can help guide you based on what meets your need better instead of what product they actually have that they can sell.
That they're offering.
Okay. I'm a full-fledged broker.
Wonderful.
Full-service broker. I offer multiple products on multiple levels. So.
Genell and I work a lot together in educating the public. We do that through these podcasts, but we also do a lot of public or live events. We just recently did one at the library with a few other professionals. But a question that often comes up for people that are just getting into it, what does Medicare cover? What does it not cover? And is it the same as Medicaid?
And that's a great question. Medicare is funded by the federal government, and you paid for Medicare through your paycheck. So you have to qualify to be eligible for Medicare based on your work history. Medicaid is run by the state, and you qualify for that based on your income and certain other criteria. You can have Medicare and Medicaid, and sometimes you get some extra benefit because of the income status that you're in.
Right.
But primarily, most people will be under 65 will be on Medicaid if they qualify. They have to meet those qualifications based on their income and their assets. Medicare, which is what we're focused on today,
Yes.
is always centered around when you turn 65. Now, sometimes you can get on Medicare earlier if you have a debilitating illness, such as stage 4 renal failure.
Right.
That's an automatic qualification for Medicare.
Okay.
You can get on Medicare if you've been declared disabled for 24 months. Your Medicare would start the 25th month. Sometimes people who have been battling to get on disability will meet that criteria sooner, but really you've met it way back when you should have gotten it to begin with, and you would have waited to 24 months. Mm-hmm. But I can help you navigate through that. Most people who are on disability coming into Medicare that are under 65, you really can't afford to do a Medigap plan. We'll go with an Advantage plan. Okay. And then when you reach your age 65, your initial enrollment period, then you can go on a Medigap plan, and you don't have to go through underwriting. You're in that guaranteed issue time.
Okay. Where it goes back to based on your working years.
Exactly. As long as you have, I think it's 40 quarters of work. Mm-hmm. Of work that is qualified, and it is set up through Social Security.
And another question that we often get, or I should say an assumption a lot of people make, is that getting help for care for a loved one would, if they're on Medicare, will be covered, and either for in the home or going to an assisted living. And I mean, I know the answer because I've heard you talk about it.
First, let me say that Medicare only covers 80%. Part A is going to cover 80% minus your deductible of a hospital stay.
Medical.
Of the medical.
Right.
Of a hospital stay. Part B is going to cover 80% minus the deductible of your doctors and your outpatients and anything that didn't apply to being in the hospital stay. Mm-hmm. Then you have long-term care. So many people think that it's going to cover long-term care, and it really doesn't. It will help you with a period of time in skilled nursing, but it's very limited. Only 100 days max. Right. So it's important to understand, and even then, you, with those who are on Advantage plan, they will have a copay after day 20. Beginning on day 21, they have a copay that goes with that until they reach the 100th day. Then on day 101, the whole family, the family or the individual is responsible for that entire cost. Right. Of long-term care. Mm-hmm. And most people don't understand that. Medicare does not cover custodial care, even in the home. So you need a long-term care policy, and this applies in the state of Tennessee. So there are some other states that do have plans that have long-term, but in Tennessee, there's nothing to cover your long-term care. Yeah. So it's important to have a plan for that. Right.
And when we say custodial, because that's a phrase that we use, and once people are in the thick of it, they begin to understand. But for those that are just starting to get into caring for a loved one, custodial care is basically the activities of daily life that people, when they're well, either physically or mentally, can do for themselves. But then it becomes custodial care when they need help bathing and toiletring, making meals, getting to doctor's appointments, those types of things. So if you're beginning that journey with a loved one and you're thinking that once they get to a point where it becomes overwhelming time-wise or need-wise for you, that Medicare is going to pick up some of these costs, it is not the case. Yeah, one of the things we talk about often is planning in advance, or at least educating yourself in advance. That's, why we're doing this today.
And that's true. It's very difficult for families. Oftentimes, children don't get involved in their aging parents' care until the aging parent can no longer do their own care. And then they're confused. Oftentimes, they don't realize what they've stepped into until they're already in the thick of things, as you said.
Right.
But there's a lot of things that we can do to prepare for that. We can have a plan. It's an important conversation that you need to have with your parent.
Yes.
As much as difficult as it is, and maybe you're thinking that they're going to move in with you. Maybe you have a mother-in-law suite that's designed for that, or maybe you have a guest room and a guest bath, or maybe you have a tiny home attached to your home, whatever that may look like. But oftentimes, children are not where their parents are. The parents are still living in the hometown, and the kids have moved away.
Yes.
And it doesn't fit the lifestyle because they're in the sandwich generation. They still have their kids they're doing for as well. And so it leaves a lot of room for what do we do. There are some options. From an insurance perspective, the best thing you can do is invest in a long-term care policy. There's also some annuities that you can take a chunk of change from an inheritance, or from a life insurance, or from money that you've saved up, and we can move that into an annuity, a lump sum that will help pay for some of that care for a period of time. Be sure you understand the policy that you're buying, because they're not all the same.
Right.
And they all have a time period. Typically they have a 90-day
So when you say
period.
time period, you mean a time where you have like a deductible time period?
Well, they have a time period that they will cover.
Oh, I see. A limit to how much.
So it might be a 2-year or a 3-year or a 5-year, or sometimes there's a 10-year. There's not a lot of them out there.
Right.
There's also a difference in having a long-term care plan only versus a different type of product that would leave benefit to your beneficiary, whoever that might be, should you not use the long-term care. There's lots of options, but you need to be aware and check into what your options are.
Well, also, I think people put off making decisions. What has been your experience with traditional long-term care policies? Like, what age? I could say, but you're the more educated person on this. What age would you say that it probably would be financially out of reach for someone, or not even possible, that they couldn't even buy long-term care insurance?
Well, once you've had a chronic condition, you're no longer able to buy long-term care. So the sooner you can get long-term care coverage, the less money you'll actually have to pay over time. Most people will wait till they're in their 50s or 60s, and assuming that they don't have any chronic issues or health issues, then it's not too terribly bad, but it's still several $100s a month to pay for long-term care. Right. The earlier you start, the easier it is to afford it and to just have that tucked away. Yeah. And then that gives you more options, especially if you go with a policy that will leave money for someone else if you don't use it. Right. So I don't like to do the policies where you either lose it, you either use it or lose it.
Yeah, a lot of the old policies were you didn't have a choice, that's what they were.
Right.
But insurance companies have gotten a lot tighter about what or how much or how long they cover. When I owned the home care agency, I had some clients that had lifetime of coverage for a large number of hours, and that's practically unheard of now. It's usually a limit. Yeah.
You can't find those policies very often anymore. Beware if one of the carriers that you currently have a policy with is trying to get you to do something different. Right. It probably is not going to be in your best interest.
Mm-hmm.
So just beware. Talk to an insurance expert who can review the policy with you and guide you in whether or not you might want to make that switch or not.
Mm-hmm.
The long-term care policy typically will go between 3 and 5 years. Statistics today show that most people will use their policy, they will live long enough to use their policy for 3 years and 9 months.
Oh, that's interesting.
So that's why
a
a
number
lot
I
of
wasn't
your
aware of. Yeah.
that's why a lot of your policies
Mm-hmm.
will be 3 years or 5 years.
Interesting. I didn't realize that. I didn't know the statistics on that. So, I don't know about anybody else, but Medicare confuses me when she starts talking about A and B and gaps, and my eyes sometimes glaze over. But as I get older, and I'm right around the corner from that 65, I'm having to pay attention a little more closely. Is there some way that you can simplify or give some framework for our, they can always reach out to you, and we'll make Genell's information available. She's volunteered to, even if she can't help you, to answer your questions. That's a requirement of anybody who's on my podcast or YouTube. But is there some way that you can maybe do a high level, just framework for us to try to demystify?
Yeah, there's 4 parts.
Okay.
4 parts of Medicare, and I want you to think of them as each one as a silo. They don't talk to each other, and they don't interact with each other. A is your hospital.
Okay.
80% of your
Take
bill
notes.
will be covered minus your deductible. B is your doctor and everything else medically. They're not going to pay for a nose job. Sorry. That's not a medical necessary.
Right.
Unless you've gotten your nose smashed and it's required for you to be able to use your
breathe
nose.
or- yeah.
So, but if you just have a knot you want taken off, it doesn't
No
work that
elective
way.
surgeries.
So, and then there's C, which is your Advantage plan. And there's lots of different Advantage plans. There's multiple carriers, just like there are for the other part. A and B are called Original Medicare, and that covers 80%. You're still going to have a 20% out-of-pocket cost. Your Advantage plans, I'll get the words right in a minute. Part C
Mm-hmm.
typically will have A, B, and D all together. They do have some standalone that don't include the prescription drug plan, but most people will get a all-inclusive Advantage plan that will actually have some extra bells and whistles. Those change from year to year, so I can't tell you specifics on that.
Yeah.
But and then there's D.
Well, before we get to D, can I ask a question?
Yes, ma'am.
So, are you saying that you would either pick separate, like A and B, or C, or would you end up picking A, B, and C? How does?
Okay. In order to have, that's a great question. In order to have an Advantage plan, you have to have A and B.
So you already have to be enrolled in it.
Mm-hmm. You already
Okay.
have to have A and B.
Okay.
So there's no getting around that. You don't have to have A and B if you don't want it. You can just have A. That's why.
If you weren't going with C.
If you weren't
going
going-
with an Advantage plan.
Right.
Okay. So
But-
if you do a la carte, you can pick and choose.
Mhm.
But if you pick C or you pick Advantage plan, you're required to have both.
That is correct. That's a
Okay.
requirement for an Advantage plan.
Okay.
Most people will have A, depending on your income.
Right.
It's probably not going to have a premium attached to it. Depends on how your work history and your income and some categories like that you talk to Social Security about. B usually does have a premium attached to it that begins when you execute it.
Okay. So when you say premium, that means it's not 100% covered by the government. In order to get your 80% coverage, you have to pay a little extra.
That's correct. You
Okay.
have a monthly premium
Got it.
that goes with that.
Okay.
And that again is based on your work history. For
Okay.
the average person, average income wise, they're looking at Right, for this year, it's $185
Okay.
a month.
A month.
And it can come out of your Social Security check, or you can pay it in a quarterly fashion. You'll mail a check in or
Okay.
have them draft it. And then there's D.
Yeah.
D for DRUD, okay?
Okay, that's good to know.
At a minimum, you need A, B, and D. You will pay some copays for your prescription. There are multiple carriers for the DRUD, and it's important that you know which drugs are covered by which carrier so that you can minimize your out-of-pocket cost.
Right.
So that's important too. A good broker is going to make sure that she asks you who your doctors are
Right.
and who your medications are, so they can more accurately shop and make the best recommendation for
Right.
what makes sense for you.
So I think that's a really good, I'm going to ask a question later, but that's a really good differentiator between someone that has your best interests in mind. That's what I'm gathering from what you're saying, is that if they've got an agenda and they're not asking you for the doctor-specific information and for the drug-specific information, then they're clearly not going to be able to make the best choice for you.
True. For example, you hear the advertisement, call us, we'll get you money. We'll get you food money, blah, blah, blah.
Right.
When you call them, they tell you, oh, okay, yeah, this is what you're eligible for. And then they take your information. They don't ask you who your doctor is. They don't even ask you about your medication. You find out when you go to see your doctor wasn't covered anymore. And you find out when you go pick up your drug that your particular drug is not in network. Or else they tell you, oh, you're not really qualified for this. You're not in the right zip code or whatever. And then you've already initiated a step that has caused you to lose the plan that you had.
Right.
It's very difficult to get the plan you were on back.
Okay, that's good to know. Now, what's happened with my mom is that when she first began being on Medicare, she's now 84. Thank goodness. I mean, knock on plastic, I guess, but thank goodness she was not taking any medications. But then recently she had some health issues and began to need to take medications. So at what point, I guess when you go and you try to fill that prescription, which you hadn't had before, and you realize that your insurance doesn't cover it, you begin to inquire about how can I get some support. Is there limits on when you can add a Part D plan?
Yeah. First of all, you need to get a Part D plan when you turn 65 or when you first go on Medicare. You should always do A, B, and D at any point in time that you're looking at that. The only time I wouldn't recommend B and D would be if you had credible insurance coverage through your job because you continue working or whatever. But you have to make sure your job is going to cover that.
Right.
But you should always have A, B, and D at a minimum.
Okay. So if you're not taking any prescriptions.
I understand, but there's that 1% penalty that you have to pay when you finally do get on a drug plan.
Okay.
And there are some very low cost plans right now that I recommend to people.
So the copay would be less than the 1%?
Yeah.
Okay.
The monthly
penalty?
premium would be.
Okay.
I don't know what the prices are for 26 right now.
Right.
But for 25, there were a couple of very low cost plans that would be much less than waiting till you needed the drug plan to pay that extra, because you have to pay that penalty for life.
Right.
My stepfather was a veteran, and he was on using the VA for his drug.
Wow.
And at that time, that wasn't considered credible coverage. It is now, but it wasn't then, and they didn't make it retroactive.
Okay.
So I had to write a check for $6.25 is what his particular one turned out to be every month for the rest of his life.
Right.
That was very frustrating.
Mm-hmm.
And I have one client now who didn't get on a Part D because she had a plan a study program that was paying for her
Right.
drugs. And she had some pretty expensive drugs, and now she's paying almost as much in the penalty fee as she is for her out-of-pocket cost for her drug.
Wow.
It's not a good idea to wait. That's why you need it. It's because of the penalty.
Right. And statistics show as we age, we're on medications. I mean, that's the reality of it.
That is the truth.
No matter how much we try to turn the clock back. So I'm going to just take a moment and give one of my sponsors credit for making this podcast and some of the live events and the website available for seniors and their adult children. And that is Mid-South Home Helpers. Mid-South Home Helpers provides in-home care for seniors wherever they call home. And we call them the home care with a heart. And that really is because the owners, not only, are they operationally and wonderful, people, intelligent people, but they also have personal experience in caring for their loved ones. As a matter of fact, one of the managing partner is caring for his mom right now. So they truly understand the challenges of providing loving care for your family. One of the questions I had was, what makes what you do different? Like, why should our viewers reach out to you, for example, over somebody else?
Well, that's a great question. I think what sets me apart is that I genuinely care about my client. I don't usually know how much commission I'm going to get paid on each carrier. What's important to me is making sure that the client gets what makes sense for them and what best fits their pocketbook, but especially what covers them the best. And I'm going to do the best that I can. I'm also going to be around later on after the sale. If you call me at 9 o'clock at night and I'm awake, I'll probably answer my phone.
Let's not make that a habit, but if you need her, she's there for you, right?
That's right.
Well, one of the reasons why I know that's very true is that we both belong to a group of professionals, and they're called the Women in Senior Healthcare, otherwise known as WISH. And there's about 13 of us that volunteer our time to share information. So we always say to know one of us is to know us all. The list of the members of that group are on my website. It's resource4care.com. And you can click on any of the recordings that are on Aging in Memphis podcast or recordings that are on YouTube just from that website. And there's also a list of all of us that volunteer to answer the phone and answer questions. Or if we don't know the answer, we probably know a lot of people that we can reach out to.
That's right. That's exactly right. So it's a blessing to be part of this group and to be able to share information with people when we're not actually trying to get a sale. We're just teaching them.
Yes.
So they feel more
It's a
confident
passion
in
we
us.
have.
That's right.
Yeah. And you can't join this group. You have to be invited.
That's right.
And I was told, you're one of the founding members, and I was told that you have to be a kind and caring person. It's a criteria. So I consider it to be a privilege to be a part of it.
We're glad to have you.
Well, thank you, Genell, so much for coming today. You really cleared it up for me, and I hope you did for our listeners.
Thank you.